Bismillahirrahmanirrahim. Hello everybody. A 23-year-old preemie gravida at 29-week gestation come to the emergency department with sudden onset severe shortness of breath. She woke up today with a fluttering sensation in her chest, which progressed to significant dyspnea, dry cough, and inability to lie flat. Recently, the patient has had some exercise intolerance and tiredness, which she attributes to pregnancy. Her medical history is significant for recurrent sore throat requiring tonsillectomy as a child. She is a lifetime non-smoker and does not use alcohol. The, the patient lifestyle is more sedentary. She immigrated to United States from India 5 years ago. Blood pressure is 110 by 60 mm of Hg and pulse is 144 per minute. The patient appears uncomfortable and ECG show atrial fibrillation with rapid ventricular response. Which of the following is the most likely cause, or which of the following is the diagnosis of this question? Aortic stenosis, aortic insufficiency, constrictive pericarditis, hypertrophic cardiomyopathy, mitral stenosis, myocardial infarction, peripartum cardiomyopathy. So first of all, this patient came to us at 29 weeks of gestation with sudden onset severe shortness of breath, and she having severe shortness of breath. With that, she having dyspnea, dry cough, and she having exercise intolerance and tiredness. Her medical history include recurrent sore throat, and the patient is immigrated from India to United States 5 years ago. On ECG, she having atrial fibrillation. So the diagnosis of this question is rheumatic heart diseases, because I will write here rheumatic heart diseases. Why rheumatic heart diseases? Rheumatic heart diseases because this patient clinical presentation, cough, progressive dyspnea, and orthopnea is consistent with pulmonary edema with rapid decompensation due to development of new atrial fibrillation with rapid ventricular response. Her history of recurrent sore throat and origin from a country with high incidence of rheumatic heart disease make rheumatic mitral stenosis the most likely diagnosis. So here the most likely diagnosis is mitral stenosis. During pregnancy, physiological increases in heart rate and blood volume rises the transmitral gradient and left atrial pressure. As seen in this patient, these changes often precipitate symptom of fatigue, exercise intolerance, or dyspnea. So here the correct option is choice D, mitral stenosis, because this patient came to us because this patient migrated from India, which is a high incident, which is from in India is a country from where the rheumatic heart disease origin is India, and the most likely diagnosis of this question is mitral stenosis from rheumatic heart diseases. Come to the incorrect one. A, aortic insufficiency. So aortic insufficiency can result from rheumatic heart diseases and present with heart failure and atrial fibrillation, but it is less common than mitral stenosis in women of childbearing age. B, constrictive pericarditis. Constrictive pericarditis present as predominant right heart failure with elevated jugular venous pressure, hepatomegaly, ascites, and peripheral edema. Choice C, hypertrophic cardiomyopathy. Hypertrophic cardiomyopathy causes left ventricular outflow tract obstruction and dehydration and hypovolemia, which worsen left ventricular outflow tract obstruction and symptom. Choice E, myocardial infarction. So MI is unlikely in a young woman with no other risk factor for coronary artery disease and with an ECG showing no ischemic changes. F, peripartum cardiomyopathy. Peripartum cardiomyopathy causes rapid onset systolic heart failure, that is fatigue, dyspnea, cough, pedal edema at more than 36 weeks of gestation. This patient medical and social history and symptom onset before 36-week gestation make mitral stenosis more likely than peripartum cardiomyopathy. Thank you.